Hello and welcome back. Another common gastrointestinal chronic condition is gastroesophageal reflux. That's when the sphincter at the top of the stomach, particularly after eating a meal, doesn't close properly, and acid from the stomach washes back up the esophagus. That acid can damage the esophageal lining. When that happens, you can feel a burning sensation. Sometimes people will cough or vomit. Typically, there are foods that will cause attacks of gastrointestinal reflux. Those foods should be avoided. Sometimes that's coffee, sometimes that's tomatoes, but every person can be different, and those foods should be minimized or avoided. There are effective treatments for gastrointestinal reflux that lower stomach acidity. A few other modern maladies that occur, chronic conditions, include a disease called fibromyalgia. This is a disease that we're seeing more of post-COVID, where we're seeing chronic fatigue, pain in the joints, multiple nervous system and musculoskeletal problems. Its effects are really not well known, and it's whilst the symptoms are very general, the treatment is in the early stages. We don't really know a lot about treating fibromyalgia. There are some treatments available that work for some people. Definitely urge you to talk to a gastroenterologist about fibromyalgia. Gallbladder disease, inflammation of the gallbladder, is a very common disease that can affect people as well. It's not really known what triggers this in most people. There are medications to relieve inflammation, and if gallstones occur, they can be removed either with ultrasound or surgically, and that will relieve a lot of pain for people who suffer from gallstones in their gallbladder. Raynaud's syndrome is a common condition where the hands can hurt, blood vessels constrict in cold conditions, and then when the hands warm up, it's very painful as the blood flow returns. This needs to be managed by the person by avoiding cold conditions. And then there's rosacea, some inflammatory skin conditions that are again quite common, but there's no real treatment for. Systemic lupus erythematosus is another autoimmune disease. This is where the immune system attacks the entire body. There are effective treatments for lupus, but you'll need to see a doctor immediately if you suffer from lupus and you see it's typically characterized by butterfly rash on the face, and oftentimes kidney problems. To cope with musculoskeletal diseases, one of the most common ones would be arthritis. People often take anti-inflammatory drugs. Rheumatoid arthritis is this common inflammation, often seen in older people. Osteoarthritis and degenerative joint diseases, sometimes occurring after joint damage that can have occurred many years prior, possibly in sports or something like that. These along with lower back pain, which occurs very commonly in people, requires rehabilitation. It is probably best to start with rehabilitation and non-steroidal anti-inflammatories before moving to surgical solutions. Typically, rehabilitation therapies involving massage and movement are very effective, and just as effective as surgery for many people. Although occasionally there are circumstances in which the only treatment available is surgical.